Coming to corneal degeneration, this is a group of disorders where degenerative changes takes place in a corneal tissue that was normal at the time of birth. The important degenerations are, so the first one, as you all know, Arcus senilis. Arcus means that arc and senilis means old age. It's the most common corneal degeneration. It is present in about 50% of the individuals above 60 years of age. If it's present in children, it's called Arcus juvenilis, that you should know. And it may be a feature of systemic hyperlipidemias. Yeah, definitely, because it happens in old age. If it happens early, then you have to check their blood for cholesterol levels. Arcus is a bilateral lipid deposition which starts superiorly and inferior perilimbal cornea. It progresses circumferentially to form a band which is 1 mm wide. The peripheral border is separated from limbus by a clear zone of cornea. That is one important key point. The peripheral border should be separated from the limbus by a clear zone of cornea. Lipid is first deposited in the anterior part of the descemet membrane and the stroma. So that's about Arcus senilis. Nothing to do. The patients will have that. There will not be any effect. It will not affect the vision. So you don't have to worry about that. Then it's a spheroidal or labrador keratopathy. That's prolonged exposure to UV light as a cause. Golden yellow spherules are seen in the interpalpebral area. It may cause visual impairment. Phototherapeutic keratectomy, we have to remove that by superficial keratectomy or phototherapeutic keratectomy. It's otherwise called climatic droplet keratopathy, spheroidal degeneration or labrador keratopathy. Compare and contrast this with band-shaped keratopathy, which we will talk about in the next slide. Next is band-shaped keratopathy. This is a type of degeneration due to calcium deposition in the Bowman's layer. It is seen as white band in the interpalpebral area with clear space separating it from the limbus. So the reason could be anything like any uveitis, long-standing uveitis, or any phthisis or atrophic bulbi that causes a lot of degeneration, that causes calcium to get attached to the cornea. That is what is band-shaped keratopathy. But the vision will be very poor because there will be underlying problem with this patient. That's the reason the vision won't be that well. But the treatment of band-shaped keratopathy is not very difficult. The recurrence is one of the issue that band-shaped keratopathy. So coming to the causes of band-shaped keratopathy, the local causes includes chronic uveitis, silicone oil in the anterior chamber. These are the reasons why the calcium gets attached to the cornea. Systemic causes like hyperparathyroidism, hypervitamin D, and multiple myeloma. All these things causes increased calcium levels. And the treatment is you have to scrape the epithelium and chelate with the EDTA, ethylene diamine tetracetic acid. Phototherapeutic keratectomy and superficial keratectomy are all future options, but the mainstay is chelation with EDTA after scraping the epithelium. But the recurrence is one of the issue that this patient has.